going to push the snow out of the way. Pushing is safer than using a shovel and raising it and moving it. And the reason is you are less likely to strain your back. You are less likely to put pressure on your heart. So the first simple thing is, if possible, when you're clearing the snow, you want to push the snow out of the way rather than shoveling it. That is a simple thing that is really, really important. The second thing is, a lot of us, when we go outdoors, we really don't realize how quickly it's going to be freezing. We may not wear the right clothing. If you're going out in your tennis shoes, if you're going out in sneakers, if you're going out in your Crocs, you are dramatically more likely to end up having damage, frostbite, to your toes. So make sure you wear appropriate clothing, bundle up, wear multiple layers. It is reasonable to think about wearing 2 layers of socks, regardless of what else you're going to be doing, because your feet are going to be exposed to the greatest amount of cold. So frostbite is definitely a dangerous thing. And that is something that occurs oftentimes without you really knowing that it's doing damage. So it usually begins with some numbness, and then it generally progresses. So if you are predisposed, you really want to be careful. And there's people with a condition called Raynaud's syndrome, where they are more likely to get frostbite because they don't have as good of blood circulation and they have clumping that occurs. So just be careful. The most common injury that we actually see are back strains from people that are doing more exercise than they normally would. So probably the best thing I would tell you is, again, what you want to do is you don't want to end up just bending a whole lot to do it. You want to be careful. The people that are the most risk for having heart damage are people that are either not usually exercising, so there's a conditioning component, people who smoke, people who drink, people who aren't thinking as clearly, or people that are struggling with their medical problems not being well controlled, whether that's for diabetes, whether it's their blood pressure, cholesterol. It comes back to bite you if you are not taking care of yourself. So part of it is be aware of how dangerous it is, take precautions, use the most logical way of moving the snow, which would be the best way would be pushing it rather than lifting it. And sometimes it really makes a lot more sense to pay a company or pay a neighbor to move the snow for you. That's one of the things. Certainly you can get a snow blower, you can get one of those things. That also takes a lot of the pressure off of your back, off of your heart. So those are just some of the winter wisdom that I would give.
Yeah, and when you said about how people don't realize, I was saying that sometimes you go out there and it's so cold that you say, oh, it's not too bad. And then all of a sudden you're looking at your hands or whatever, your face, even your cheeks, and, and it's a problem, right?
It is, because part of it is you get numb before you get the damage. And so it is that numbingness that prevents you from realizing just how bad it is. And so, yeah, you really want to be careful. That's where partners, having somebody that can at least encourage you to take better precaution, that's a good thing to do.
I did see in some of the stories regarding the storm, and this wasn't in Ohio, but there were 2 people that died shoveling snow because they had heart attacks. And so it's not like you can say, oh, that's not going to happen. It does. It happens pretty frequently.
It really does. Yeah. And so the cardiologists are saying starting at the age of 45 is where you start needing to be more careful. So anyone aged 45 and older, that's where that's where this advice comes. So be careful if you're over 45. For the most part, it can still be anybody, but the biggest danger is that it increases your risk for a heart attack, or if you're really stressing yourself, for a rhythm condition called atrial fibrillation, which again can cause you to pass out. So you really, really want to be careful. That is correct.
So if you feel like maybe you have frostbite on your fingers or something's happened, how do you treat that? I mean, I know people say, oh, run it under hot water, and that's not good.
Well, part of it is frostbite is a condition that is usually going to end up damaging. So generally you just feel some numb, feeling cold, maybe there's a pallor, clumsiness, something like that. The risk is alcohol, smoking, and certain medications. And so the treatment is rewarming and medicines that we use. So running hot water can actually burn it. What you want to do is you want to be carefully, slowly increasing the temperature. So you want to start at around maybe 100 degrees or 105 degrees. You don't want it to be scalding. You don't want it to be burning. That will do even more damage. So you basically want it to be rewarmed to just a little bit above room temperature, or body temperature. But for the most part, you don't want it to be super hot. That is correct.
All right. Well, a lot of great tips, Dr. Stam. We appreciate it. And you stay warm, and we'll chat next week, sir.
Thanks, Pam. I look forward to it.